people came forward to be vaccinated, which is a record for a weekend day, really pleasing to see, and 29,816 people came forward for testing. Again, another strong number for the weekend. So I want to thank everyone who has stepped up and done the right thing for our community. Every test, every vaccine, every check-in makes a difference and gets us to where we need to be. And to that end, workers in residential disability settings and private aged care have an additional day on Monday to make the most of their priority vaccination blitz, which you heard from the Minister for Health yesterday. They can visit the website coronavirus.vic.gov.au to see where to go for priority walk-up vaccinations. And in a few days' time, as we've already announced, we'll see Ambulance Victoria staff there too for their priority vaccination blitz. In terms of the outbreaks, our public health teams are continuing to chase down every possible lead to find their origin, particularly the Delta variant, and Professor Cheng can speak to that shortly. Again, we're calling on the public to assist us by checking the exposure sites on the coronavirus website and coming forward for testing if you have even the slightest hint of symptoms. Public health teams are also focusing on Craigieburn Central Shopping Centre and a number of other large retail settings just like it. Text messages will go out today to people in Craigieburn and surrounds, reminding them to get tested if they have any symptoms. We want to cast the net far and wide, and that's how we will know that we're on top of this. In terms of the announcement that we're making today, over the course of the week, we've announced over $460 million of business support. And we promised that we would come back to provide further support, additional support for tourism and accommodation operators. This is particularly important because for a period of time we will have different settings between metropolitan Melbourne and regional Victoria, and that will include over the period of the long weekend. So we knew that this is tough on everyone. It's tough on all businesses. It's a particularly tough period for tourism and accommodation. So to that end, today we're announcing a $32.2 million package. It's made up of $16 million to provide a further round of the very popular regional tourism vouchers. So there'll be a further round of 80,000 vouchers, $11.8 million, which is the tourism supplement top-up of $4,500. So for all tourism operators across Victoria, in addition to the business support, this will mean that tourism operators will receive $7,000 in additional support. And finally, $4.4 million for the Alpine Support Package. And this is an acknowledgement that, you know, when you think about the ski season and the disruption in terms of the lockdown and a period of time of restricted travel for Melburnians, this is particularly disproportionately going to impact on our alpine resorts and all of the tourism operators who support that. So there's grants of up to $15,000 for on-mountain operators and $5,000 for off-mountain tourism operators linked to the ski season. So to go through some of the detail, I'll ask Marty to come forward, and then after Marty, we'll hear from Professor Cheng, and then happy to answer any questions. Marty.
Thanks, James. James has really given you most of the detail. As the Acting Premier indicated, when the government announced that after next weekend there would still be a period where Melburnians would not be able to travel to regional Victoria, we indicated that there would be a specific announcement in regards to tourism support. And we have been providing tourism support throughout this pandemic, but another round of it is very important. So, as the Acting Premier indicated, another 80,000 travel vouchers. They've been incredibly popular. They've meant well over $100 million have been spent in regional Victoria as a consequence of those vouchers in the past, and they remain incredibly popular, so there'll be another round of them. In regards to support for accommodation and other tourism businesses, at the moment, if you're in regional Victoria and you've got an entitlement to one round of the Business Cost Assistance Program, that is $2,500. There will be a $4,500 top-up to take you to $7,000. If you're a metropolitan business where you are entitled to 2 rounds of the Business Cost Assistance Program, that is $5,000, there will be a $2,000 top-up. So all regional and metropolitan tourism operators will be entitled to a total of $7,000, which is equivalent to the Licensed Hospitality Venue Fund 2-round option that is in effect at the moment as well. In regards to alpine resorts, as the Acting Premier indicated, they are uniquely affected because the earning period for an alpine business is much shorter than an accommodation or tourism business in the rest of the state. The ski season is for a defined period of time, and the Queen's Birthday long weekend is one of their biggest weekends. And so in recognition of the fact that that will be disrupted with only region-to-region travel over that long weekend, there'll be up to $15,000 for on-mountain employing businesses, up to $10,000 for on-mountain non-employing businesses, and up to $5,000 for certain off-mountain businesses. That takes the entire business support package, which we've announced over the last week and a half, to just under $500 million, about $493 million. It is substantial support, and the government will, of course, continue over the course of this pandemic to do everything we can to support the business community in what is an incredibly difficult time. We understand how deeply affected the business community is by not just this lockdown, but by the effect of the entire pandemic. And we'll continue to provide business support as we have done over the last 15 months and get as many businesses as we can through this very difficult period. I'll hand over to Alan and then we'll take questions.
Thanks very much. So today we're continuing investigations into the source of the Delta variant outbreak. As was mentioned yesterday, the sequence data has been run against the national database, and we've contacted all the other labs in the country to make sure that all that sequence data, all that genomic data is up to date, so that can be rerun again. There's always a small proportion of isolates that can't be typed. Most of these are actually historical infections, but we're obviously keeping a very close eye on and examining these cases more carefully. We're working with MDU to see if there's any further information that can be obtained from these specimens. In terms of the current outbreaks, the City of Whittlesea outbreak has no new cases, leaving the total at 29. The Port Melbourne workplace outbreak has 30 cases now. That's 5 more than yesterday. But 4 of these are previously unlinked cases that now have been linked through genomic and epidemiological investigations. There's 1 new case associated with this outbreak who's linked to the Port Melbourne Finance Company and has been in quarantine during their entire infectious period. The aged care outbreaks remain at 6 with no increase. As the Acting Premier said, the West Melbourne outbreak, which is associated with the Delta outbreak, has 1 new case. That brings the total to 10. In terms of the primary school associated with this outbreak, 98% of the Tier 1 contacts have returned a negative test so far, but will remain in quarantine for their incubation period. In terms of the other exposure sites of note, public health teams are focusing on a network of small businesses on levels 4 and 5 of 227 Collins Street, which is at the corner of Collins and Swanson Streets. 1 business in this building was previously listed as an exposure site, but this has now been expanded. So if you're here during business hours between the 31st of May and the 3rd of June, you're a primary close contact and you'll need to get tested and quarantined. Also in the city, contact tracers have been investigating a construction site where a positive case worked. The department has identified now more than 200 close contacts listed to this site, and there's priority testing continuing today for those people. We still have more than 6,000 primary close contacts in quarantine. But as we get further into this outbreak, obviously some of these people are reaching the end of their quarantine period and have tested negative. So today we expect to release more than 1,900 people from quarantine, and we thank each and every one of them for their cooperation. We're continuing our call out for people who shop regularly at either the Craigieburn or Epping Plaza shopping centres to come forward and get testing. If you have tested, please, if you have symptoms, please get tested, and that's always our consistent advice. But if you've been to any specific exposure sites, and particularly at the Craigieburn Central or elsewhere, please check the website and follow the advice to get tested and isolate and quarantine if you've been at a Tier 1 site. There is now a new pop-up site at the Sprint Pavilion in Craigieburn. I understand that's walking distance from Craigieburn Central, about 700 metres. In addition, there is a dedicated lane for testing of any staff members of Craigieburn Central at the Royal Melbourne Showgrounds. We're also focusing our efforts to try and improve testing through targeted engagement within the areas of Craigieburn and Epping. And we've been working with local leaders and community leaders there to put on-the-ground testing engagement staff at Craigieburn Central and Epping Plaza. But if you have any symptoms at all, please come forward. We are still seeing evidence of likely transmission between people that don't know each other, and we really need to make sure that there's good testing numbers to make sure that we're picking up anything. So yesterday there was another strong number of people that got tested, smaller than earlier in the week. I think most people that that would have got tested have been tested, but certainly if anyone develops symptoms, please come forward for testing. In terms of the release last night from the CHO release, there is an unexpected wastewater detection in the inner west of Melbourne, and the catchment includes Aberfeldy, Essendon West, Flemington, Footscray, Kensington, Maribyrnong, Moonee Ponds, Parkville and Travancore. So this new detection is of interest because there are no confirmed cases in that area. There one case that is resident in that area but is in hotel quarantine. So we strongly urge anyone in these areas with even the mildest symptoms to come forward and get testing. Certainly the Melbourne Showground has 8 lanes of testing and has a lot of spare capacity over the last week, despite the high numbers of testing across the state. Finally, over the coming days, I'm expecting some bad weather. So if you're getting tested or vaccinated, please check the forecast and check the online maps for different options. Occasionally, we need to temporarily shut down sites because of wind or weather, and we're doing our best to try and keep those going. So finally, for what remains of the lockdown, I'd really ask Victorians, please reach out to people who might be doing it hard. Please stay at home and obey the rules for if you do need to go out. If you're at all unwell, please get tested, and if you're eligible, please get vaccinated. So thanks very much.
Holden Street exposure site, Professor, the office. Who's that linked to? Is that one of the Delta outbreak cases?
Yes, I understand so.
Yeah, and on the exposure sites that were listed yesterday, there was a Greenvale shopping centre, a Thornbury Market, a Woolies in Preston South. Are they all linked to new cases in the Delta outbreak as well?
So that's linked to one of the 2 new cases from yesterday. It's a pretty precautionary one because we think that the symptoms, it was right on the edge of when those symptoms might have started, so 2 days before that. But they are both, as I understand, Tier 2 sites. So if you've been at either of those, please get tested. And
the wastewater testing, there are exposure sites in those areas. There are no positive cases, but there are exposure sites.
Yep.
So how concerned are you by that, or do you just think it might have been the person who attended an exposure site urinating there?
It could be either. So if anyone who's been in those sites or lives in those sites, if they're at all unwell, please come forward for testing, and that will help sort that out.
Professor, are you looking at lifting the lockdown given the low numbers at the moment? And if not, why not? And can you step us through exactly what you're looking at as to why you won't?
Yep. So we think about in terms of upstream risk and downstream risk, and I think in terms of downstream risk, we're sort of neck and neck with the virus at this stage. So of the people that we're finding, there's a small number of exposure sites, but really most of the people that we're seeing at the moment are people that are already in quarantine, and therefore there's no downstream risk from that. I think what we are somewhat concerned about are the upstream, so who, for these cases that we can't find who gave them infection, and particularly the family that returned from Jervis Bay. We are concerned about, who was it that might have given them infection, and therefore, could there be other infections related to that? I think it'd be fair to say, just given, I think 5% of Victorians have been tested in the last, the last 7 days. If there was a big outbreak going on, I think, we would expect to have picked it up, but, there's always that risk, and that risk does fall over time, but we are still concerned about that, and that's where all our efforts are going to investigate.
So do you think that the lockdown will continue to the end? Is that what you're thinking?
It's a day-by-day proposition. That's our expectation, but we don't want to be in this any longer than we need to. So if we can, we will lift it early. But at this stage, our expectation is that it will continue to Thursday.
So an ordinary just one more. Ordinary people look at the numbers; they're very low, extremely low. So you wouldn't go into a lockdown with numbers like we have at the moment. What is the price? The Delta strain, or what is actually stopping you? Given that businesses are bleeding.
Yeah, it's both that upstream and downstream risk I've explained, and the upstream risk is the one that we're particularly worried about at this stage.
Professor, the teacher you mentioned who is now infected, is that the class teacher of the 2 grade 5 students or another teacher at the school?
I don't think I really want to speak about specific cases to avoid identifying
and
someone. Yeah.
On the Port Melbourne cluster, you said that's had 5 more cases added to it that were previously unlinked. Can you talk us through some of those?
Yep. So there were 4 cases that were previously unlinked that are now linked, and then the 1 new case. The 2, so they're 2 groups of 2. They're both partners of each other, if that makes sense. And with genomic and epidemiological data, we've been able to link them to exposure sites. So one of them was at the Craigieburn Shopping Centre. The other one is a resident very close to the area and had visited the general area. And I think there's enough information to say that they were linked to that outbreak.
How many cases are still unlinked at the moment?
I'll have to get the exact numbers for you. There's obviously the whichever the first case in the city of Whittlesea outbreak. There is the first case in the Maidstone aged care facility. There's obviously the Jervis Bay family, and I'll just have to check if there's one more, but I think that's it at this stage.
Sorry, Professor, I understand that there's probably no hard and fast rule with it, but in terms of the health team's comfort in terms of not knowing the origin of those cases versus the time and the number of tests in the community for when you can become comfortable that they're not still circulating, how close are you to getting to that point of comfort?
Look, it really is a judgment. There's testing to weigh up. There's who those people were, and do they perhaps represent a community that might be marginalised and therefore not come forward for testing. There's their activities and what settings they might have gone in. There's really quite a lot there. And then there's obviously, for the Delta outbreak, the possibility that it might be in New South Wales. So that they're all going into that judgment. I think it's fair to say that with the passage of time, we get more comfortable with unknown source cases if they haven't transmitted, or there's no hidden transmission going on after 1, 2, 3 weeks. And for example, in Sydney, that unknown source case in Woollahra, they never found that link, but obviously they're not worried about that anymore because it's so long ago. So it's the passage of time and a lot of the other factors that I've just...
Obviously, I think it was case 5 and case 16. We're 3 or 4 weeks out from the initial one now. Are they almost discounted and it's more down to the Delta case, or is there differing levels of concern still with the original ones?
Oh, look, we always have a baseline level of concern when we don't know where there's a case, I think. But as you say, I think we're more worried about the origin of the Delta variant at this stage. But we're still continuing to look at all possibilities, and particularly, but as you say, I think the Wollert case is going back quite some time now. So I think any hidden transmission from that is probably less likely.
So if we weren't already in lockdown from the Whittlesea cluster, would we have entered lockdown because of the Delta one? Is the risk that significant, or is it kind of an added bonus that we're out, so it gives us a chance to look at it in a bit more detail?
Look, I think it would be difficult to know, but I think that we would be very concerned if there was a Delta variant outbreak, and I think by chance, perhaps, we were in lockdown, and I think we're very glad that we were when that emerged.
Last week, when we extended the lockdown for a week, one of the underpinnings was wanting to have 2 incubation periods from the first infection of the previous outbreak, the Kappa one. Now that there was essentially a week until we saw the Delta, do you need to see more than just 7 days of no new Delta infections? Would we need to extend potentially because we need to see a whole incubation period?
Yeah, it's not only the cases, but where they are at times. So again, the sort of downstream and upstream risks. So the downstream ones, I'd be a little less worried about. If they're people that have been previously identified, then we're sort of confident that we have those contacts under, in quarantine. For the upstream ones, it is a judgment. The incubation period is up to 14 days, but most of those are, half of them are within 4 or 5 days, and then another quarter are within a week. So level of worry goes down as time goes on.
Professor, Arcare have just issued a media release saying that they have 2 new cases at Maidstone. Are you aware of those?
Aware of those. They were reported early this morning, and
Sorry,
we haven't got those fully worked up those details yet.
Thank you.
How many Delta cases do we have now? 10?
So in the West Melbourne outbreak, I'll just get the numbers exactly. Oops. Yes, that's 10. Yep.
The Port Melbourne case, how many days after the exposure did that person become positive?
It was apparently right at the edge of the incubation period, so I think it was the day 13 testing. But just noting that people don't get tested every day while they're in quarantine, so perhaps that person might have been positive for a few days and then but asymptomatic.
So how long will that person now need to be isolating?
So there'll be a judgment made on if the person gets symptoms and the other details, and then there's ongoing testing and so on. So that judgment will be made then.
No, I've got a question for the acting Premier actually. Just on businesses, news today of Jala Pulford having meetings and encouraging business leaders to get employees tested and saying that we need a 70% vaccination rate to end these mass lockdowns. Do you stand by that? Is that the conversations that are going on behind closed doors?
Well, what we need is people to be vaccinated. This is undoubtedly a race. At the moment, we've got about 2 to 3% of our population fully vaccinated, and around 20% of our population have received 1 vaccination. But our path through this pandemic is via 1, the successful rollout of the Commonwealth's vaccination program, and secondly, alternative quarantine. Now, we've got the path through with alternative quarantine, and we'll get that built as quickly as we possibly can. In terms of vaccination, I'll ask Professor Cheng to speak in more detail in terms of herd immunity and the expert public health advice. But 10% fully vaccinated is better than 2. 20% is better than 10. The greater the level of our population that is fully vaccinated, actually, the greater the population of our population that gets one dose and then fully vaccinated, every step you take makes it easier for public health to provide advice in terms of easing of restrictions, how we deal with outbreaks. That's what we've seen right around the world and in other jurisdictions. Other major jurisdictions have got populations that are vaccinated fully vaccinated, well above 50%. So this is a race. The virus doesn't sleep, it mutates. And the Delta and the Kappa variants that we are dealing with this year are 50% more infectious than the virus we were dealing with last year. So this is a race, and we need to get as many people vaccinated as quickly as possible. There's been some very good discussions with the federal government in terms of additional vaccines for our state site, additional Pfizer vaccines for our state sites. But we also agree with the AMA here in Victoria that our GPs can do double what they're doing right now, and we're having ongoing discussions with the Commonwealth. So the answer to your question is that Every step up helps in terms of the public health response to the pandemic, but I might get Professor Cheng to talk in more detail.
Just before he does, 70% though, is that the magic number to end
Well,
mass lockdown?
Professor Cheng's the appropriate person to ask that question. The point I'm making, and the evidence and the experience worldwide, is the greater the level of your population that is vaccinated, the better it is in terms of easing restrictions, dealing with outbreaks, undoubtedly. And that's what we are seeing in terms of the transmission of the virus. Vaccination is our pathway through this, and right now only 2 to 3% of our population is fully vaccinated, and we need to get that number up as quickly as possible because this is a race. In terms of 60, 70, 80%, it's appropriate that Professor Cheng answers that question.
So there isn't one single magic number, and the reason is that we vaccinate for two reasons. One is the direct protection that the person gets from getting seriously unwell, and then there's the indirect protection about passing it on. And the herd immunity issue is about indirect protection, but obviously we're still vaccinating for direct protection. The reason why there's not one single magic number is that it depends on who it is. So we've correctly, I think, made the decision that we're starting with more elderly people, people who are more vulnerable at getting severe disease, to try and directly protect them. But they actually don't contribute much to indirect protection. People in nursing homes don't have many contacts in the community, for example, so they don't contribute much to that sort of herd immunity. But people who are younger, who are much more social and have many more interactions tend to. So that's why there isn't that magic figure. But I think, as the Acting Premier said, and I think the experience from other countries shows that, once you get up to much higher coverage rates, then it makes a whole lot of things easier. That, we may not need the intensity of restrictions, or we may be able to, only do contact tracing without having to do other things quite to the same level. And that's the benefit of vaccination. So every vaccination does count, just as every test does count.
Would you agree then that we are a long way off the end of the mass lockdowns then, given that we're nowhere near 70%?
Look, I think in the short term, we do need to do this to get on top of things. My hope would be that, while we're still continuing to roll out the vaccination campaign, we can keep a lid on it and have no community transmission, and like we had before. But there is a sense of urgency. We can't hold this forever. If you look at other countries, particularly in our region, they're having to go back into lockdown. So it's like a dam wall that is straining, and it's a difficult one to hold back.
Alan, how many of our hotel quarantine cases have the Delta strain here and interstate as well?
Look, I can't. I couldn't give you exact figures. I have to get back to you on that. It's certainly a decent proportion of the ones we're seeing. They're not specifically from India, which is obviously the country where it was first reported, but the Delta variant is becoming more widespread overseas as well, including the UK and the US.
Still no working theories as to where our Delta has leaked from?
Look, we have theories, and we're working through those. So we're looking at the people. If you sort of think through it, it's the people that the sequencing wasn't possible. So obviously, it's like a fingerprinting database. The people that have had the fingerprints, you can say, they're not the source case. So we're looking at those that had a partial sequence or couldn't get sequenced at all. We're looking at making sure that everyone had their isolate sequenced, and that's why we've asked all the other labs in the country just to upload everything to make sure that we have, and even sort of partial sequences to make sure that there's enough information that we can go on. And then we've obviously looked, I think as was mentioned yesterday, at people who are exempted from testing for whatever reason, to make sure that they got, exempted from hotel quarantine, to make sure that they got tested.
Is there anything to report back on the ones who are unable to be sequenced? Is there anything to report on whether any of their movements aligned with the West Melbourne cases? Have you got to that point?
Yeah, not at this stage. We did, so in terms of the sort of the partial sequences, I understand that the matching was run again yesterday with everything that had been uploaded around the country, and nothing came up again.
With the wastewater testing, is it possible to use any of those findings and trace them back to specific variants like Kappa and Delta?
Not really. Obviously, the wastewater catchments serve quite a large, relatively large population, so it's not like you can go door to door. You can go to sort of sample further upstream, and for example, in aged care facilities, sometimes you can sort of specifically try and sample wastewater, but that's clearly not possible in, for every household in that area.
We've seen quite a few cases pop up in hotel quarantine. Are you comfortable our current hotel quarantine program is safe enough to withhold them?
Look, we're doing everything we can. We're testing the staff every day. Every person that goes into a red zone in hotel quarantine is vaccinated. There's been lots of work on airflow and air purifiers, and we've locked the windows to make sure that you can't the wind doesn't generate pressure. There's everything that's being done for that. I think as I think it's pretty much been very well discussed about alternative arrangements, and Avalon or Mickleham or wherever might be a better control, but we've put enormous number of controls in place in CQV, and I'm pretty confident in those, but it'd be nice to have something that's custom built.
Mr. Merlino, can we just ask, the government obviously has to make decisions based on the health advice, but 2 cases, I think one was already in isolation, very, very, very low numbers. Time to pull the trigger and lift the lockdown, do you think?
Ferg, that'll be absolutely based on public health advice, and that's the way we have approached this pandemic, and it's the only way to approach this pandemic is to follow public health advice. As I said a moment ago, we do know that the Kappa and the Delta variants are 50% more infectious than what we were dealing with last year. We all want to get back to the point we were a couple of weeks ago, in terms of crowds at the footy and people living and working as normally as possible in a COVID-safe way. But the only way that we can get there is by following public health advice, having this period of lockdown so we can drive this thing to the ground. The last thing we want to see is this variant of the virus getting out and becoming uncontrollable. So I want to get there as quickly as you do, as quickly as every single Victorian family, business, community in regional Victoria or metropolitan Melbourne. We all want to get through this period as quick as possible. It'll be based on public health advice. My expectation, and Professor Cheng confirmed that here again this morning, my expectation is by the end of this period we'll be in a position to have further easings of restrictions in regional Victoria and careful easing of restrictions in Melbourne. But we just got to drive this thing to the ground.
There was advice on Wednesday, say for example, that we needed another 3 days just to be super cautious, but there was a view among you and your colleagues that that was too cautious. Would you make a political judgment to amend that health advice or find a middle ground, or are you 100% set on following whatever Professor Sutton advises?
Well, I can tell you that politics isn't going to defeat this virus. Commentary is not going to defeat this virus. The only thing that will defeat this virus is following public health advice, supporting the 2,400 people in our public health team that are chasing down every case to drive this into the ground and make our community safe. We don't have the luxury of picking and choosing the public health advice that we receive. I hate going into lockdown. Like every single Victorian, I want to be out of lockdown as quickly as possible. But the way to do that is for people to get tested, for people, if you're eligible, to go and get your vaccination, for people to follow the rules. We want to keep regional Victoria safe from this virus, and that's why we'll have settings that will be different for a period of time. All of the things we do is to keep our community safe. I know this is hard, and that's why I'm standing up with Minister Pakula today announcing further support for Victorian businesses. We know this is hard, but the only way to defeat it is by following public health advice.
Professor Andrews put out a photo last night of the Premier having a haircut. How is he?
He's recovering well, and it was good to see that image of Dan getting a haircut. Good to see him put out that statement last week. We'll see him back on deck, subject to his doctor's advice, but see him back on deck at some stage this month, and I'm looking forward to it.
Mr. Merlino, when Victoria came out of the second lockdown last year, there was a public roadmap to reopening with public triggers and thresholds for when certain restrictions to be lifted under what circumstances. Can we expect something similar this time around?
Yeah, it's a good question. We're living in a different environment this year to last year, and based on the fact that there's a reason why public health is so concerned about the Delta variant. It is much more infectious than what we were dealing with last year. So, in terms of announcements that we may make on public health advice and giving a sense of what the year looks like, we'll have more to say, but again, that'll be based on public health advice.
Can I ask you, you've got a lot of sole traders and small businesses who don't turn over 75 grand a year and therefore not registered for GST. They are missing out on the government's grants at the moment. Why are we leaving them out?
Well, it's the same as every other business assistance package that we've had. So all of the rounds of the business support fund last year, that lower GST threshold was the starting point, and those effectively home-based businesses, which most of them are, who operate at that very low level, were supported by JobKeeper. So this is no different to that, and it's our understanding, based on discussions with the Commonwealth, that likewise those smaller businesses, and I should make the point that those sole traders who do qualify for GST are being paid under the Business Cost Assistance Program, but those under the GST threshold, who are mainly home-based businesses, were supported last year by JobKeeper, and our discussions with the Commonwealth over the last 24 hours leads us to believe that they will also be assisted by the Commonwealth program that's been put in place.
WA Stadium Chiefs a couple of days ago again put their intention out to host the grand final. If we're in a situation in 4 or 5 weeks where we might not be in lockdown, but there may be restrictions on crowds at the footy, if we're say a month out from finals, would it be possible for the AFL to commit to hosting the grand final at the MCG if there's no certainty about whether they could have 100,000 there?
I have absolute confidence that the grand final will be at the MCG. It's very easy to forget that it's only just over a month ago that we had almost 80,000 at the MCG for the Anzac Day clash. I speak to the AFL most days. The fact that the West Australian Stadium and or government would like the grand final really isn't news. It's pretty obvious that they would, anyone would. But the fact is, one of the reasons we are doing what we are doing now, as the acting Premier says, running this thing to ground, trying to snuff this out, is we know there's lots of, incredibly important stuff happening in the second half of the year. We've got school holidays only a few weeks away, grand final, Melbourne Cup, Boxing Day test. We want all of those things to happen in Melbourne, and for us to be back in the situation we were just a couple of weeks ago, where we had large crowds, full restaurants, business trading profitably, and we're going to try and get back to that position as soon as we possibly can.
We just had Singapore cancel their Grand Prix at similar time to our one. The MotoGP is about a month before the Grand Prix here. Can you give us an update on your conversations with those companies that run those events? Where are the negotiations at?
Well, I won't give you that update. I will say that the Singapore decision is Singapore's decision, and it's not particularly relevant to the discussions that we're having. The Australian Grand Prix Corporation has submitted a COVID-safe plan. There are ongoing discussions between my department, Health, CQV, AGPC, Formula One management. They are very complex. They are very delicate. I don't propose to hold those in the public domain.
Could a hub at Mickleham Avalon, which could host players who could train out in open fields, which David Fox has flagged as a potential for the Avalon site, could a site like that assist us in hosting those events?
Well, look, I'm not going to, when I say I'm not going to discuss details of those negotiations in the public domain, I'm not going to then sort of salami slice discuss them. They are very complex discussions. All of the sorts of matters that you would expect that need to be raised, how people would come in, how they'd be housed, how events would take place. They are all part of that discussion, but these are serious conversations, and they're best conducted in the way that they are being conducted, rather than via the good offices of the press corps.
Mr. You've got absolute confidence in the Grand Prix. How confident are you that we'll have, in the grand final, how confident are you that we'll have the Grand Prix in November?
Oh, well, look, the grand final is a couple of months before the Grand Prix. The grand final and the Grand Prix, though, present incredibly different challenges. I mean, the grand final is a domestic crowd with domestic competitors. The Grand Prix is overwhelmingly international competitors. So comparing those two things is not particularly helpful, and I don't think the grand final and anything that might relate to it is particularly relevant to the Grand Prix, because they are very different challenges.
Mr. Bakula, regional golf clubs are kicking up a stink at the moment about the caps for 50 people in their courses, saying it's being played outside, it's very safe. Why should they suffer the way, metropolitan, or I guess almost the way metropolitan areas are? And they said they've made representations to government. Any movement or any chance of movement or easing of restrictions for those clubs?
Well, look, I've spoken to James Sutherland from Golf Australia. He's made his feelings about it known, and I understand those feelings. It is, golf is an outdoor sport, but and played over a large area. But equally, the public health team and the chief health officer take a lot of things into account including, how many people might gather in car parks, how many people might gather on putting greens, how much of a magnet and a draw card it becomes, and takes all of that into consideration when determining those limits. Again, I don't want to see those sorts of limits in place for any longer than they need to be, and I'm quite sure that's the view of the public health team as well. As soon as we can safely lift those limits, I'm sure that's the advice we'll get.
Just for the sole traders watching at the moment, what sort of assistance do you think they can expect from the feds? You mentioned in the last 24 hours it's changed a bit.
Oh, well, the Commonwealth scheme that was announced, as I recall it, provided payments for between $325 and $500 a week, depending on where organisations are located. But again, let me make the point: sole traders are treated the same way as employing businesses under the Business Cost Assistance Program. So if you're a sole trader that pays GST, you're treated the same way as an employing business that pays GST. Those below the GST threshold, and bear in mind, a lot of those businesses are, very small operations, and for us to be able to determine who does and does not need support in those circumstances would be very, very difficult. There is no difference between the way this system is working, or this program is working, and all of the programs between that were in place in 2020, or indeed the lockdown payments in February of this year.
Well, you're confident that Victorian sole traders won't be left out?
Well, as I say, we have had discussions with at a bureaucratic level with the Commonwealth, and it's our understanding that there will be a degree of support along the same lines and with the same parameters as have been put in place for income support for those casual workers who fill that criteria.
In regards to regional sport and Victoria again, there's a few towns that straddle that metropolitan Melbourne regional Victoria boundary, and there's some confusion for some of them where their kids can go to school in regional Victoria, but they can't play junior sport over the weekend. Is there any consideration about creating exemptions for some of these border towns?
Well, again, the metropolitan regional divide is there for a reason. It's there to protect regional Victoria's COVID-free status. And whilst I understand that it's very difficult for those young kids who want to play sport this weekend, we want to get out of this as quickly as we possibly can and get that back to the situation we were in only a few weeks ago. So, I don't expect that there will be exemptions granted for sport over the weekend beyond the more general settings that are put in place. But these settings are there in the way that they are there to try and get us through this as quickly as humanly possible so everyone can get back to something closer to normal.
I'll just get one more to the National Premier, sorry, just really quickly. A peak body for children with autism have called for specialist schools to be reopened. Last year they were opened when normal schools weren't. Why was the change? What caused the change this time?
We've had a couple of differences. There was a period where our special schools were open fully, and in previous circuit breaker lockdowns, we've had the settings that we have right now. So I understand this is very difficult. We've got all of our schools are open for vulnerable children as well as children of authorised workers. And on Friday we had our year 11 and 12 students back. I want to get all students back as quickly as possible. That's my focus as Education Minister, and that's going to be based on public health advice. So we have had in previous circuit breaker lockdowns the similar arrangements that we've got right now.
Our kids spend about 4 times more at home than kids in other states did last year. Have you been briefed, or is there work going on in the department on what the long-term social impact of that might be on their learning and lives?
Yeah, there's no doubt that the period of lockdown has been a challenge for kids, for their parents and carers. We know that there were some kids, many kids that thrived through lockdown. We also know that there are many children who struggled and will be struggling right now, and we need to get them back to school as quickly as possible. It's why we, this year in 2021, given that for most of term 2 and 3 last year kids are at home, we've got around 6,000 tutors in addition to schools' existing teachers and staff supporting kids who struggled. It's why the focus has been on student mental health and wellbeing. You know, we just announced our budget just a few weeks ago with $3.8 billion of additional support to rebuild our mental health system. That includes one of the key recommendations of the Royal Commission in terms of providing additional mental health support for our schools. There is no doubt that trauma has a tail, and you only have to look at the Black Saturday bushfires, and there are communities, individuals, families who are still struggling today with the trauma of that event. So we understand that, and that's why such a great focus has been on, one, having thousands and thousands of tutors supporting kids through small group tutoring to get them up to where they would have been had it not been for the pandemic academically, and it's why there's a singular focus on mental health and wellbeing of our kids.
Mr Merlino, it sounds like New South Wales is going to be pushing for its own dedicated quarantine facilities to be funded by the federal government. Is that something you'd support?
Oh, absolutely. You know, we need to see across our country Howard Springs type facilities, purpose-built alternative quarantine, and the primary objective for us in Victoria, for New South Wales in terms of their interest in an alternative quarantine, is about lowering risk. You know, so if we have, based on where people are travelling from or their particular individual circumstances, if we've got a purpose-built facility where the highest risk individuals could go and we have lower risk individuals through our hotel quarantine system, that would make our country safer. So fully support New South Wales and any other state or territory advocating for a facility that we're going to build here in Victoria. Thanks all.
Thank you.